most famous physical therapist on the internet.
Hi folks, I'm Bob Shrupp, physical therapist.
Brad Handheld, physical therapist.
Together we are the most famous physical therapists on the internet.
And our opinion, of course, Bob.
Today we're going to show you the number one thing to help heal your Piriformis Syndrome. And that's pain that you're getting down the leg.
Yep.
We'll describe it in just a minute. Plus we're doing a giveaway, Brad.
That's right, Bob.
If you are new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. How come Sam's facing this way?
Well, you'll find out.
Yeah.
It's a secret.
Go to bobandbrad.com, go to the giveaway section, and we are giving away a handheld massager.
Ah, it's a nice one, too.
Yeah, and it's inexpensive.
Yes.
These work really well.
Especially if you win the giveaway.
Yeah. You go to Facebook, the contest will be pinned to the top of the page. Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program.
There you go.
We have Sam out here for a reason. We wanted to show where the piriformis muscle is.
Right.
Interestingly enough, what happens is this is a short little muscle that can actually put pressure over the spinal cord.
Not the
sciatic nerve.
Yep.
There we go. So the sciatic nerve comes down there, and it's a little muscle that it attaches over here on the sacrum, and it comes over here and attaches on the greater trochanter. So from here down to here. Kind of triangle shape,
right.
If I remember right, Brad.
Yep, it's a little hip muscle.
And it go right over the sciatic nerve, or the sciatic nerve might even puncture the muscle. But what they're finding now, Brad, is, and we're trying to always keep up to date on things.
Sure.
They're finding that there may be also other muscles involved, and the gemelli, and so they call it deep gluteal syndrome now.
Yeah, as far as the average person, that's probably not that important,
right?
What other muscles are in there, but
because you're going to do the same treatment,
right?
So,
but it is they're really getting into the details.
Yeah. Now the other thing is, there's actually that muscle could be tight, but it could also be stretched out, and it would still give you problems.
Too loose.
The number one thing you need to know is which one you have. Is it short or is it long?
Yeah.
Because if it's short, you're going to stretch it.
Yep.
If it's long, you don't want to stretch it. It's already stretched out.
Right. You want to strengthen it, shorten it.
So we're going to show you one quick test. You may need somebody to help you do this.
Yeah.
But that'll help tell you whether or not it's long or short. Now, long. Before we even show the test, Brad, I'm going to show you how long can occur. You can move him over.
Sam's done.
Yep, Sam's done.
Sorry, big guy.
He's going into retirement. I'm going to put this down here. So, and this is from Sourman, Shirley Sourman.
Yep.
If you want to lie on your side,
You
Brad.
want it right here, like
yeah,
right
we're going to do this one first.
Now?
Remember?
Okay. Yep.
Lie on your side.
Oh yeah, that's right.
Yeah, now you're remembering. Yes, let's say you have somewhat wide hips. You're a female, or even as a male, and you sleep like this position on a regular basis. You are stretching that muscle out. This is exactly the position that does that. If you do it night after night, I had this problem, Brad. I started having hip pain just because I was sleeping kind of like this.
Mm-hmm.
And I actually, you sleep with a pillow between your legs, and that takes care of the problem. But this something like this to stretch it out. You can also stretch out the muscle is if you're a younger athlete and you do squats and your knees, when you're doing the squat, actually turn in like this.
Mm-hmm.
You're putting stress on that muscle,
sure,
undue stress on that muscle, and you're stretching it out a little bit too.
Right.
So those are the ways to stretch it out. Now, why is it short? Well, one, if you sit a lot, it's going to shorten up. And which is very common nowadays, unfortunately.
Sure.
And also, if you fall or have trauma or a sporting event, that actually tore the muscle.
Sure.
So
it scars up and tightens down.
And that seemed to be the case with a lot of people I had. That it seemed like it was actually torn, the muscle, and it scarred up and tightened down.
Sure.
So, all right, let's show the test, Brad.
All right.
Let's pull you this way.
We're just doing this because it's easier to see.
Yeah, you'll be able to tell better what we're doing here.
So you need a second person to actually kind of do this. So I'm the one being tested. We're going to check my left.
Now it's interesting. Brad has loose hips the way it is in one direction.
Right.
So it'll be interesting to compare the two. But what you do is you have the knees are probably bent to, what is that, Brad? About 45 degrees.
Right. So not way up
not
here.
way up there. Yeah, you got to be down a little bit because, interestingly enough, this muscle does different things depending on where your hips are at.
Right.
So some of this may not make sense to you, but just follow us. We'll give you the truth.
We'll guide you.
So what you're gonna do is I'm gonna grab under the knee and I'm gonna bring the foot out like this. And this is internal rotation. And if the muscle is tight, it's gonna be tight this way. If it's really loose, the foot's gonna go out further. Now you thought this one was a little looser, Brad?
Yeah, my right side. I think you'll see that.
Oh yeah. So now this, by the way, is probably just getting close to normal. So what you'd see is you're going to look for the differences between the two sides. Let's say this is a painful side, and we check it, and yeah, it's tight. Let's say this is a painful side again, and we check it, and it goes way out here.
Mhm.
That means it's long. So you want to compare it to the side, like Brad, I said, is lacking. This is probably close to normal, but still lacking a little bit, I would say.
Yeah,
So
that's my natural tendency.
So if you find out it's short, we're going to stretch it, and let's show you how to do that right now, Brad.
Sure.
So
We're gonna do the figure 4.
yep, figure
Yep.
4.
Should we turn it?
Yeah. Probably turn again, huh?
Yeah, it's a little easier
For
to
your-
demonstrate.
Your viewing pleasure.
Yeah. Oh my gosh. All right, here we go. So you can do this on a bed, or carpeted floor might work a little better. But we're gonna do what we call a figure 4, like this. Put your ankle just above your knee. Don't go way up too high. Try and get on your thigh a little bit, and then we can push here.
But you're actually going to bring it up. Yeah, that's going to give it the stretch.
Yeah.
You may need a towel or a belt or something to go around the leg if you
Yeah.
have trouble reaching that. But we're going to show you another way to do it in a chair,
Sure.
so that you, if you can't get this position, you can certainly do it in a chair.
Sure.
So
All right.
you want to do it on here, Brad,
Well,
or
I'll do this leg, then you can. That's the same thing. This is the opposite leg.
Right,
The
right.
view helps a little bit.
I can show on the chair, Brad.
Okay.
Mike, am I too close? No restraining order against me?
And this should feel good. It shouldn't be a painful stretch. And actually, right now, I can tell I'm loosened up a little bit.
Sure. So I do the same thing. Put my ankle right above the knee on the opposite side. I'm stretching the right side.
Mhm.
And you're going to actually push down, and then you're going to lean forward.
Sure.
Now, when you lean forward, don't round out your back. We always want good posture.
Yep.
So good posture, lean forward, and that's going to give that baby a good stretch. Now, some of you might thinking, well, I thought this was an external rotator. I'm getting into the weeds a little bit. right
Yeah.
here.
Right.
Actually, the Piriformis, when it gets way up to the top here, beyond 90,
Mhm.
it's actually an internal rotator. So we got to stretch it into external rotator. I'm sorry. I just want to make sure.
Just in case there's a
Yeah,
few
somebody
PhDs
go.
out there.
Right. So the other thing that is very helpful, and I have found that this really makes a difference, Brad, with any patients I've had, is to actually massage the area too.
Mhm.
So massage the muscle. Again, there could be some scar tissue. And what I have found, it's hard to do yourself with your hands.
Mhm.
I mean, you can do it. You can find the tender spot and massage it. But that's where our actually giveaway this week works out really nice. So it's the handheld massager. And what this will do, there we go.
Yep.
I'm sorry, I was supposed to let go. Huh?
Yeah, it's a little different than our other ones.
Yeah. Our other massager, actually, you got to hold it for 3 seconds.
Right.
And this one, you got to just hit it once. So the handle makes it nice because you can get in there easily, more comfortable
Right.
than one of the massage guns.
Right.
And
he's talking about, versus this type of a gun.
right. And it's got different speeds, picking up more and more. And you can see.
That allows you to get in there without wearing your hands out.
Right. I would actually go on the highest speed, to be honest with you.
Yeah, that's kind of a personal thing. You'll learn
Yeah.
very quickly what works best.
Yep. And you can massage that that's the beauty of having a massager, is that you can actually do it for a long time without fatiguing.
Right, without getting your fingers all worn out.
Right. All right. Let's say that's what you're going to do for a short muscle. You're going to stretch it. You're going to massage it. Let's say you have a long piriformis muscle.
Sure.
You're going to strengthen it. So the first one is clamshells. Brad's going to demonstrate those.
To start out with, you'll just lie on your side like this. you can, it's nice to have a pillow. You don't have to, but it's a lot more comfortable. And you simply work it like this. So this is working my right piriformis. Take it up and down, good control. We're just not flopping around here. And you'll be amazed that 10 to 15 of these with good control is going to start to fatigue that muscle. If you do want more resistance, you can get the bands. Like I have a loop band here
Yep.
that goes around.
But don't start off with that. That'll be way too much.
Yeah.
Just start off with gravity, against gravity.
Oh, wow, that is a
Yeah, that starts to feel it, don't you?
yeah, and you can vary the resistance if you get a little closer
little
to your
higher
hips.
up,
It's a
sure.
little easier, so you can vary the resistance by the location of where you put it. But 10 to 15 reps of those is typically good. Are we going to go right to the standing?
Yeah, well, it's the standing. What's nice about this, Brad, is this is kind of functional. So
Yeah.
if you are that person that was squatting and your legs are going in,
Mm-hmm.
this will teach you to squat and keep your legs out, externally
Right.
rotated.
So I'm going to practice squats with the band around here, but I'm not going to let this happen. Because the band is pulling it in, so we're going to actually resist the band, push it out, and
Right.
hold. And boy, I could.
Can you feel
You
it?
get a real nice indication of where those muscles are and where that piriformis is.
Yep.
Um,
Again, that's a progression. That's probably the one that you're going to do later on
yeah,
after you've done the clamshells without weight.
probably more for that athletic type person.
Yep.
If you're just maybe older senior.
Yeah, you might not ever get to a band.
You may not need that.
Yeah. So, by the way,
Wow.
Brad and I can fix just about anything
Except for
a broken heart.
right, and
We're
the
working on it,
piriformis
right?
is a long ways from there.
Yeah.